All right. So we should check the groups.
Yeah,
there we go.
Thanks, Travis.
All right. If we want to go ahead and get started, I don't know. Do we want to wait on folks to get here, or what are y'all thinking?
Sure, I'm happy to. Do we know how many people we should be waiting for, or anybody we want to contact to come in?
It'll stay recorded afterwards, right?
Correct. It says here that we have five, 6 people popping on. So basically, I guess I'll jump into this. We're going to be discussing a little bit of what the USVA and INS Analytics has been doing behind the scenes now that our Supreme Court case has come to an end. Jared's going to give us a few updates, and everyone is going to hear from Jake and Amber about some of the coming testing and things that we'll have coming up. So with that, who wants to go first?
Well, I guess since I think the last update or the last major action maybe that at least that I posted was about, the update from the Supreme Court that they declined to hear our non-delegation challenge. And so just to follow up on that, and I think to get as a segue into what we're doing now. So, we were trying to take just a death blow to the FDA's authority to regulate this industry whatsoever without further, legislation. And so the Supreme Court declined to review that issue. So that's at an end for now, at least, which means that I think where we are legally is just trying to help as many people as possible, as many people as are interested in doing the PMTAs and staying on the market and moving forward, and trying to force the FDA or work with the FDA to the extent they will to facilitate that pathway for small businesses that they're required to facilitate.
No, thanks for clarifying that, Jared. It brings a lot of at least it brings clarity in my mind as to what the next steps are for those who are ready to continue filing their PMTAs. And we're really blessed to have the support of Amber and Travis bringing us all together too. I'd love if Amber, if you could kind of introduce us to the background on where we stand today and being blessed to have Jared's help here with us.
Okay. Basically, I just want to talk about how kind of INS Analytics came to be, and then our relationship that we've kind of formed with NN Analytics, who is Jake, the owner of. So basically, the USVA is a 501(c) nonprofit. And so in the bylaws and there's other things, they're not allowed to engage in activities like this, what we need to do as far as PMTA assistance, like preparation, deficiency letter assistance, and if somebody were to get like a remote regulatory assessment, where we could help them process it. And obviously there is a fee that we would charge for our time for some of these services. And so that's why we created INS Analytics as a separate entity, and so that's basically who INS Analytics is. It's a spinoff of the USVA. There are some similar owners there, but the USVA, the board members, nobody can take a salary, nobody can take any money. The volunteers like myself, we are all that, just volunteers. We receive no payment, no perks, nothing. And so, we've teamed up with NN Analytics and been negotiating, working on this for about the last 4 to 5 months to try to get the most cost-effective analytical testing package to satisfy the FDA requirements for all areas of the PMTA. And so I think Jake wanted to talk about his business. You're muted, Jake.
That's what I get for trying to be courteous. Oh my God. No, thank you for leading everything kind of right into the meat on the bone, Amber, too. I'm really pleased to be working with, and our company, NN Analytics, is pleased to be working with ENS Analytics by way of the USVA. It's a really refreshing opportunity to be working with a group of small businesses like ourselves. So we're really keen on supporting small business within the PMTA strategy. And in analytics, our company has worked since 2015 on preparing with the FDA for this testing, for aerosol testing, liquid testing, stability testing, a few other areas of interest. But we've really honed down our focus into some specific types of testing, HPHC and stability being the most interest to the FDA at this current time. And that's what we've partnered with the ENS Analytics group to put together a testing package that allows us to take all of the data that we could assemble and present some specific packages at reduced costs to the USVA members. Rather than focusing on each company individually, we're allowing the members to come together as a unit and present packages to each group rather than each individual. We're really, really excited to be working together, and we've put in some ample time in preparing to service each of these small businesses. Yay.
And so, basically the last 6 months, I've been working with some IT people and things like that to put processes in place where we've been helping people who did not submit a PMTA by the September 2020 deadline. And so myself, Jared, have helped people with deficiency letter responses, things of that nature. And so that's kind of why you haven't really seen a lot of updates in the USVA group, because all of us, myself, Travis, have been extremely busy. Jared was, working on the Supreme Court case. And, now that we're focusing or moving our strategy forward is, kind of where we are in, trying to help people to stay on the market and work through the process with the current clients that we're helping, and anybody else out there that may need help. They can reach out to me, they can reach out to Travis, they can reach out to Jake, you can private message me, whatever. Email me. We want to help the small businesses. We want to help the people that thought, I can't do a PMTA, or I did a PMTA, I can't afford testing. And so, myself, Jake, Travis, we've all been working on this. And, I think that, what we have to offer is something that most small businesses can afford who thought they couldn't.
That's very well put, too. There's a lot of interpretation of the statutory requirements as being pretty overwhelming. But when you look at them and you really dive down into what the FDA is looking for, you're exactly right, Amber. There's some very specific points. And we're excited to work with with USVA members to be able to meet those requirements as a unit rather than as an individual. And it would be really, really exciting to start to get to know each of you guys, individual companies, a little bit more. We've been preparing, like Amber said, for about 6 months now for a very big presentation next week on the 13th of July. We'll be presenting more of the costing metrics like Amber's hinted at, a lot of our plan for addressing the reduced cost testing program in detail. We'd love to reveal to all of you at that time. And we're really excited to get to know each one of your companies and how we can work with you and never against you to work past this deadline. There's some defined pathways to work towards, and there's a lot of outside support too, even to the extent of some monetary support for lending when we're at that stage.
That's right. We have a couple of people that are in the industry that will definitely reach out and help all credit types, that whenever you get to the point and you have that cost breakdown of what you're going to be looking at, if that's something that you guys would be interested in, you just let us know and we'll get you set up directly with them.
Yay. A couple of small things too to go over. We're working really hard. So we've been working hard for the past 6 months. We find ourselves in this last 2-month time frame from July and August, just before the September 9th deadline. So literally 2 months and 2 days from where we find ourselves. Our goal as a team together is to get each one of the members and non-member businesses with an amendment together to file with their PMTA by the 9th of September 2021. We'd like to send the FDA the data that we have, as well as a timeline of the testing activities, so we can keep them interested in the PMTA. We want to keep information flowing their way, and we want to keep the information at a steady pace so that they can look at it, see it, understand that they have to wait with the Office of Science to see that information. And we're ready and prepared to not just file the information, but work with each of the companies to, once the information has been filed, to continue to supply additional amendments as needed. That's a really key point on why we're actually working on a timeline with all of you guys right now.
Yeah, and so, my goal is the clients that I'm working with, and I've already spoke to them about, it's important to try to get their PMTA as soon as possible so that they can at least be in the accepted or the filed phase before that 9/9/21 deadline approaches, and then have an analytical testing contract with NN Analytics in place to go through that timeline to show that you are working towards compliance. And that is exactly what the FDA wants to see from the conversations that I've had with them. As long as you show that you are, progressing forward, moving in the right direction, they're willing to work with you. And especially some of the smaller, like micro businesses who are kind of more limited on the cash flow or, things of that nature. And so, basically what Jake had said about filing an amendment, submitting it through e-submitter, all of that needs to be done before that date, just to be safe. We don't really know what is going to happen after that date. None of us do, because they haven't put out any guidance. And so Jake is very familiar with all of this because he's done it. And so he can explain maybe just in a small synopsis a little bit more.
Sure.
But,
yeah, what we're working for, like I hinted a little bit earlier, is we're trying to feed them as much information that we have at the time in a continual manner. So not overloading them with too much, not underloading them with too little. There's a Goldilocks analogy right here. We're looking for the ability to get them a scheduled timeline and feed them those amendments so that the Office of Science, when they review this data, they're required to see it in its entirety. And that's what they need to make a determination for the appropriate protection of public health. That's that APPH analogy maybe you guys have seen thrown around everywhere. When the Office of Science has a need to review data, enforcement actions might not take place. They need to be able to have a succinct understanding of the product's health and safety. And if there's additional data that they're expected to receive, this is a very key step for us to keep ahead of the curve. We want to work with each of the companies to have this data being fed to the FDA Office of Science on a regular basis. Again, keeping the conversation out of enforcement action will allow all of the products that we're submitting through the PMTA pathway to remain on the market and not need to withdraw from the market, such that the sales can continue while the data is being supplied to the FDA. That's all of our goals here, is to keep each of the members' companies' products on the market. And there's multiple ways to do so. We have a couple of other strategies we'd like to reveal on the 13th in specificity as to what actions we'd like to all take together. But the main goal here is to retain the services of an analytical lab, get a timeline prepared and ready to amend to the PMTA, start whatever is feasible monetarily or not, and develop a plan that works and send it. and stick to it. Don't deviate from it. And when data becomes available, even if it's small pieces, one analyte out of 14, one data point out of 7 flavors, we're going to send it to them. And we're going to let them know that there's a regular flow of information for them to chew on, and to not send out questions for, what about this? What about that? We want them to anticipate, oh, they're aware of this and that. Okay, here's the date that they're going to send us this and that. Let's sit pretty and wait. We want to be in that mindset. That's how the Office of Science has traditionally worked with a lot of other clients we've liaised with. Some of the larger companies that submitted full PMTAs last year by the September 9, 2020 deadline, a lot of the Office of Science questions were, okay, so you sent us this information, now what about this? That triggers a timeline that we have to respond by. And some of those response timelines are different timeframes. We've seen letters that have 14-day response times, 90-day response times, 180-day response times. There's a lot of variation in there. We want to try to stay out of the realm of receiving those letters asking for additional information. We want to flip the script. We want to let them know we've got the data to send them, and here it is. I hope that's understandable for everyone here too, because it's a complex topic, and we're going to get into the meat of it next week on the 13th. I'm excited to be there with all of you.
Yeah, and let me jump in. Sorry, Travis, but just to maybe clarify a point there. And this is bad news, but also good news at the same time. For if you're out there, and you haven't submitted a PMTA and you're still selling your products or not, trying to sell them again. Under the Maryland court's order from last year, the year before, you were required to submit a PMTA by September 9th, 2020, in order to take advantage of the up to 1 year grace period that, if you get it filed and it's being reviewed by the FDA, you're able to continue to sell your free-based nicotine products, right? Or whatever products are tobacco products that are not already have not already received a marketing authorization order. You were allowed to stay on the market for at least for up to a year while the FDA reviewed it. Well, a lot of people, and the people I think a lot of the people we're speaking to now, did not file a PMTA back then. And we talked about all that at length, while that went on. I mean, it was not feasible. It's completely ridiculous. It was literally impossible for anybody to file an actually complete one that had all the testing, unless you were Juul or somebody that started, years before and spent millions of dollars on it. So for the people who are in that box, you haven't submitted a PMTA yet. You are not. The FDA would say your products are misbranded and adulterated, and you're not able to sell the free-based nicotine e-liquid products right now without a marketing authorization order. But so submitting a PMTA will not give you the ability to immediately sell those products, but it will. So that's the bad news. The good news is that, and I know this firsthand from working on behalf of, I think, 6 different clients at least, who have received warning letters from the FDA saying, some of the firms that have been picked out, as you all know, the FDA publicizes it on their website like monthly, hey, we sent out more warning letters. We're popping these companies for selling these products without a marketing order. I've worked on behalf of several of them and talked to the FDA, been on these phone calls, and what all of them have said is, we're working on our PMTAs and we hope to go back to selling our, regular products if we get a marketing order. But in the meantime, we've switched to using synthetic nicotine in our e-liquids, and therefore you have no jurisdiction over us, over those products at least. And the FDA has acknowledged and accepted that answer. And then I believe that is the only thing that they can accept as a function of the tobacco product definition. So in other words, 2 points here, one is bad and one is good. Number one, you can file a PMTA still at any time, and you can file it a year or 2 from now. There's no deadline on when a company can file a PMTA. It's just that if you did not already file one by September 9th, 2020, you can't take advantage. You're technically supposed to not be selling your regular free-base nicotine products. But at the same time, if you just buy synthetic nicotine and make your e-liquids with synthetic nicotine, the FDA has no jurisdiction over you, and they are not pushing that issue right now. I think they accept that, and what they're doing with people who have said that is they're verifying it. Basically, they're asking for product samples to test them and make sure that it is synthetic. But they basically said that they're going to close, if they verify that you are using synthetic, they're going to close the matter out and leave you alone. So, and that's an easy switch for people to make. The synthetic costs more, and that's one of the reasons why I think people have an interest in trying to get authorization for their regular products. But switching to synthetic for your e-liquids is going to allow you to stay on the market with, using the same recipes you have now. You just use the synthetic nicotine.
It's well put, Jared. That's the goal, is to keep the products on the market for the members, regardless of what pathway we do it. That's all of our goals. We want to help you guys get there.
And
right. Go ahead.
Then, while, and I've worked with some that you have not worked with, Jared, and used that same strategy, and been on calls with them, and they've done exactly the same thing as what they've done with you, is requested the samples, all of that. And basically, they're making synthetic, they're using synthetic, making their products. And then while we're working on their PMTA, that's just kind of like their Band-Aid for right now. Because
that's a great way to put it, as a Band-Aid. Yeah.
We all, kind of know in the future that kind of what's going to happen. They haven't come out and said it, but, we all know what the definition of a tobacco product is. Yeah.
Well, let's anticipate this is a Band-Aid that definitely closes the wound and it's not bleeding, but this is a stitches option that we need to go in and stitch up a little later too. The main goal for us to be filing PMTAs, if you're in that boat, if you haven't filed a PMTA yet, but now we've gone through the conversation of feasibility, both monetarily and with internal resources on each of your guys' companies' ends, we want to be filing those PMTAs so that we can inform the FDA, yes, truly, these are pre-market products. That's what the PM stands for. And we want to prove to them that your products were on the market before August 8th, 2016. That's a big section of the PMTA. And I know each one of you guys has some great evidence, whether it's sales records, marketing materials, production receipts, and master batch records of any sort, any of that. We want to help assemble and put into this PMTA so that the FDA understands, oh, these guys really do have to get grouped with the pre-market group. They'll at that point send a filing letter that they've received your filing. And that's a really good step. And we want to work as hard as we can to get that acceptance letter. And if possible, before September 9th, there's a really good opportunity for us to get those moving and in place so that when it's time to enter the market with that PMTA that's been now in an acceptance phase, if you do have a grandfathered product, there is an opportunity for your products to remain on the market on a case-by-case basis. And this is what we're really, really driving forward with a high amount of acceleration in this direction too. We want to be able to present to the FDA each one of your financial situations. If you guys feel comfortable sharing it with the USVA, we'll prepare a very specific letter. This is a cover letter as to the testing plan, the costs, the reasons in support of a small business needing additional assistance in the form of additional time or additional internal FDA resources that we've all been preparing for you guys to get this project done. They're willing to sit down, again, on a case-by-case basis. Those were the words used in the draft guidance for small businesses to make sure they can meet those statutory requirements. So if we've got a little bit of an extended time frame we need to work with, let's just do everything in our power to give them the data they need now so they understand we're willing to work with them. And it's a very powerful motivator pushing products through the PMTA pathway, knowing that we're satisfying the statutory requirements And it's a matter of time before they ask for the data that's left. And that's what we're prepared to produce for you guys, not just today, but when it works for your company.
And I think Travis has his information about the synthetic.
Yeah, so for a while now, I've talked with quite a few people privately, and one of the things that we've been putting together for a minute is working directly with liquid nicotine wholesalers as the USVA. And they've basically come in and given us a price for USVA members at $750 a gallon for 100 milligram synthetic nicotine, that is TFN by Next Gen Labs, which we know for a fact is exactly what the FDA is asking when you're sending in samples regarding the synthetic. So that is the only one that we know 100% will not flag anything to show that it is a registered tobacco product or anything along those lines. So what we'll be doing is, and have been doing, is with a few of you, as we've talked about it, y'all have kind of put out a number of how many gallons you would want to give you an idea. If you were to go right now to liquid nicotine wholesalers and say, I want 1 gallon, I'm wholesale of 100 milligram freebase nicotine, or excuse me, 100 milligram TFN nicotine, what's that price? They would tell you it's $949. You'd be able to go to one other place and it's $949. So basically, with us going to them as an organization for a group buy for our manufacturers, we can get it at $7.50 a gallon. We basically have to hit a 55-gallon drum marker. We're really close to it. We're about anywhere from 15 to 20 gallons away from hitting that 55-gallon marker, and that's without even making it known here in the group so far. So I'll put up a post again, and it doesn't matter if you need 1 gallon or 2 gallons or 10 gallons. That price will stay the same, and we'll basically get you taken care of and get you your synthetic nicotine a couple $100 cheaper than what it'll cost you to go and buy it elsewhere directly. So we will we'll put up a link here in both of the groups, and if you're interested in it, you'll put your information in, and we'll turn around and reach out to you and get everything set in place for your nicotine to come to you.
Jared, did you have anything else?
No, I think Jake and I think Amber, y'all both touched on it earlier after I talked a moment about the PMTAs, but like you said, like using synthetic right now is a great option, really the only option for people to stay on the market who are manufacturers. And so it's a good thing to do. And this group buy, this reduced price is a great, benefit for people to get that, to bring some of that cost down. But ultimately, ideally you can go back to the regular products that you make and sell with the PMTA.
Correct.
And it's also important because, which, in the end, would save a lot of money in your manufacturing process if you can get away from the synthetic. But also, there's a question of how long the FDA is going to, or Congress is going to, if they're going to go on the rampage again and try to amend the law or force the FDA to regulate the synthetic products, so there's just a lot of uncertainty on that side. So I think the PMTA process, like I said earlier, it's kind of a Band-Aid for the time being, but yeah. The PMTA allows you to go back and with the flexibility to go back to selling your regular products at a lower cost on the manufacturing end. And maybe necessary too if the FDA changes its tack or if Congress, forces them to.
That's really well put. Yeah.
I want to add one thing. Somebody asked a question about, so synthetic nicotine, we don't need a PMTA. If you look at the definition of a component in the guidance, it says basically anything used with a tobacco product. And we know that's a tank, a coil, a mod, whatever. So, and it doesn't matter what you put on the label. It's about customer perception. There's other studies that I've researched that the FDA has published and guidance on, It does not matter what you label that product. It matters what your consumers perceive it as. So if you go synthetic nicotine, even though you put do not use this with a tobacco product, in the end, we don't know when that end will be, but it's eventually, and in my opinion, not to be the bearer of bad news, it is technically a component, even though it's not derived from tobacco, because a tank is not derived from tobacco. A coil is not derived from tobacco. And so I've seen other companies label, synthetic products. This is not to be used with a tobacco product. And again, it goes back to precedence of the FDA that's there that shows it's about consumer perception. So it doesn't matter whatever you label it. If I sell a vitamin supplement and say, something, whatever, don't use this as a vitamin supplement, but a consumer perceives it as a vitamin supplement, then it's a vitamin supplement to the FDA. And it is going to work the same way with the tobacco products, because they did this vague, encompassing, sweeping definition of component, tobacco product, the other things that they've listed. So I'm not a lawyer, but in my opinion, what I've read and the studies that I've looked up that the FDA has precedence on, it will be eventually, once they get done with all of the PMTA processing and start pushing all this other stuff, I really see them coming and saying it's a component. And I don't want that to happen, but I'm just being realistic as somebody who's worked for the government for a long time and knows about regulations and things like that. And so that's why we're kind of saying it's a Band-Aid to get you through the process.
Well, and if I could jump in real quick, I would. One of the reasons I'm staying involved as we go forward here is because while Amber, I agree with you that the FDA and Congress, like I said, one would hope that the data coming out of Europe, right? Like there's always new studies coming out showing how ridiculous this FDA's just crusade against this stuff is, and anti-science it is. So there's a chance that at some point in the future, like, sanity will prevail. But
yes.
But if that doesn't happen, yes, the FDA or Congress or both could try to go after the synthetic based e-liquids, but I think we would have a really strong legal argument against that. And because I think when you think about it, an e-liquid that's made with, if you're selling a flavor, let's say if you're selling either because you can buy the nicotine by itself and put it in flavors to make to put in an open tank system, the consumer can, or you can buy the juice that already has the either free base or synthetic nicotine in it. I would say if you're manufacturing a juice with synthetic nicotine, my legal position would be very strongly the FDA. That is not a tobacco product, no matter what the FDA tries to say about it. It's not like a coil or a battery or a tank or a mod, because that you can use it with whatever type of juice you want, right? And that could be a tobacco derived juice. But if you already have the synthetic nicotine in an e-liquid, that's not a tobacco product by definition in the statute. And nobody's reasonable perception would be that I'm going to take that juice that already has a flavor and already has synthetic nicotine and put more nicotine in it, and free-based nicotine derived from tobacco. That's the only way it could become a tobacco product. I would say, in other words, it's not, the juice that's made with synthetic is not a component of a tobacco product. So you can put that in a tank. The tank is only regulated because it's a component or accessory of a tobacco product. But if you're putting synthetic nicotine in it, so that's why the FDA can regulate the tank, because it can be used with free-base nicotine. a juice with synthetic, it could not be regulated in the same way.
So not to contradict what you're saying, because you're a lawyer and you know way more than I do, but here's my conundrum is that something that's 0 milligram nicotine, it has no nicotine in it. You still have to register that as a tobacco product. So that's where I get my logic from. They're saying something that doesn't even have nicotine in it has to be registered as a tobacco product because it's used in a tobacco product, meaning
right. But that's because the consumer can also buy the pure nicotine and put it in tobacco derived nicotine and put that in the juice, and therefore that juice that doesn't have nicotine is reasonably intended to be used by the consumer with tobacco derived nicotine. But if you're selling a juice that already has synthetic nicotine in it at the consumer's desired level, they're buying it, they can choose, do I want 5, 10, 18% nicotine? There's no reasonable expectation that consumer is going to put more tobacco derived nicotine in that juice. So that synthetic based e-liquid is not a tobacco product.
So you're correct there too. The problem is that the user, and we're talking about the perception of what could be what, is the atomization device, the tank and the coils are considered a tobacco product because they could get considered both. It could be for tobacco products or for not tobacco products. I don't know what you're going to go use this tank for, but there is a chance for it to get used with tobacco products. Now, if we're classifying synthetic nicotine as not tobacco products, it's being classified that way because of the federal statute that defines tobacco products as those coming from tobacco. Now, there's multiple precedents, not just in the states themselves that we all live in, but other countries around the world whose definition of a tobacco product is different. And this is what we're playing devil's advocate on right now, too. We want to prepare ourselves for the situation where there's one of two possibilities. One, the FDA reclassifies tobacco products as those containing nicotine and or coming from the tobacco plant. Just on a perception use of customers, they want to regulate nicotine use in not just the adult population, but very much so in curtailing it in youth populations. The other side of the coin, though, is that they might adapt a totally different structure through the synthetic nicotine, not being under the jurisdiction of the FDA, but even worse, being under the jurisdiction of CDER, under the Drug Research Center, requiring a much more rigorous pathway for regulatory approval. What we're trying to do is open up regulatory pathways that will allow a company to have a product on the market, since we know going through a regulatory pathway is going to mean sales for a long time. If you pass through a regulatory pathway, you're in compliance with federal statutes. That's what they want companies to follow. And if we're avoiding the PMTA pathway, we're only going to find ourselves falling down another pathway. So if there's the ability to wait and draw that out as long as we can with the help of synthetic nicotine, because that's the status of the world we live in now, there's a great opportunity for every member in this organization to keep their products on the market, attack a regulatory pathway that'll solidify your business for tens of, hopefully 50 plus years. And I know we're excited for that too. And I think everybody out there should be. This is overwhelming, but we don't have to take off more than a bite at a time. And it's the real focus of all of us right now, is to get everybody behind the fact that eventually at some point in time, we're all going to have to start this regulatory journey. And it behooves us all to start it, just a little piece of it right now, while the time is still ripe for the picking, that allows the most options, the most abilities to keep products on the market. And hey, if you have a PMTA on the market right now and we get our work started, there is no reason for you to retract your product from the market as of this September. Keep it on the market until we get comments from the FDA back asking us to do so. That 1 year grace period doesn't end at September. It ends when enforcement action starts. And that's the place in the weird area with when we're using synthetic nicotine. If we don't have a PMTA filed, and we're trying to think about answering the question, there's a really good question from Roger. we're saying if we don't have a PMTA, am I going to be able to sell without, with synthetic nicotine? Yes, of course, we're going to be able to sell with synthetic nicotine, but for how long? And we've worked so hard to acquire customers, build a business, keep ourselves running and feeding our families. We want to build this for a long time. And the way to build that for a long time is to start the regulatory pathway in the background while we keep all options on the table. If for some reason the FDA sends a letter that says we'd like you to retract your product from the market while we finish your application, our response is going to be, oh, dang it. But okay, because we have a backup situation. We're able to keep products in the synthetic form on the market while that's being addressed. The revenues are coming in, customers are being satisfied. They see the business is strong. In the background, we're working even harder for that to be the case 10s and 50 years in the future. It's really strong, and it's a huge reason for us to have the presentation today and to go into it deeper on Thursday, is to get everybody behind the pathway of regulatory approval.
And Jared, I was playing devil's advocate, like he said.
Yeah.
That's from me, like working in government and knowing how things are. It's like one person can look at this application and one person can look at the exact same application and have two different outcomes. One can have deficiencies, one cannot. And so it's all about who is reviewing your PMTA. So one person may get through on what everybody submitted, the exact same thing, and some people may not and come back with deficiencies, because it's all about who reviews it and how well you have backed up and made reasonable arguments that are logical. So that's why the government leaves everything vague. It's not to try to shut your business down. It's for you to be able to explain why you thought something is this way. And if it's a logical explanation, they will accept it. And
Well said.
And they use it in another sense to people who don't comply, and then turn it and twist it on you as hard as they can. And so that's why I was kind of not meaning to overstep anything that you've said, Jared, because that's not what I was trying to do. It's just I'm playing the devil's advocate, because I just kind of, I don't know, just with my experience with the government and I just don't foresee it going a long time, because of how hard Congress is already pushing back about youth this, youth that, everything. It's about the youth. And, it's an unfortunate situation that, that we're in, unfortunately.
No, and I didn't take it that way. And trust me, we have to play devil's advocate. And if anybody knows, well, I'll tell you, well, I don't think they have the authority under the statute to try to regulate juice made with synthetic nicotine.
Right.
That doesn't mean that somebody at the FDA is not going to take the contrary position, contrary to the statute, and say it anyway.
Right, because it says on a case, they even address synthetic and say it's on a case-by-case basis in their little question area about things. There's actually a little question there.
Well, and just like with the FDA, just ignoring their obligations under the, to facilitate a small business pathway under various federal statutes. When they issued the deeming rule, they didn't do that.
Exactly.
They just ignored their obligations under federal law, and they do it until somebody, forces them to be honest. And a lot of times it takes litigation. So,
well, that's kind of the plan that we are all 4 of us together are working on. We're just not ready to talk about that yet.
Right.
That's why we're all excited to have you guys on the 13th next week to try to get a better understanding of exactly what that's going to look like too.
And we'll put the link. Travis is going to put the link, I think, for the synthetic, maybe a Google form or something, and then Jake and I will link the Google form. I've already emailed it to probably 300 people, but I'm going to put it in the group. So if you want to hear the actual the specifics of the testing approach, the pricing, that's what we're going to, me and Jake, and if Jared or Travis want to be on next, on the 13th, you need to fill that out to get your invitation to listen to that presentation. Anybody else?
That's very, very well said too.
Yeah, that's exactly what I'll do. Is I'll throw up a Google Doc sign up form for the synthetic stuff. So today or tomorrow morning, this evening or first thing tomorrow morning. So, and I'll be there for the Thursday, July 15th, just to be a part of it.
And if anybody has any questions that they didn't ask over in the comments, you can email me or message me on Facebook, or post on this in one of the Facebook groups, and one of us will answer your questions for you, unless it deals with something that we're going to cover on the 13th.
And I'll be taking the call from inside the analytics lab, walking you guys through a couple of the procedures, showing you where samples will be held, a lot of what we're going to be doing, and how your samples will move through the analytics lab. So I hope I can get a better feel on what we're actually about to embark on as well.
But, we really need, I know that, we had some members drop after the Supreme Court debacle, I should call it. But now is the time that we need the support, because we have things that we are working on in the background. We're not giving up. Jared has said, he's in this till the end. And these are things that help us keep helping you. All of the membership dues go to legal things. They don't go, like I said, to any board member, to any volunteer, anything like that. So, that's why INS Analytics was created, so we can continue helping people. And basically, you're just paying for like the PMTA process, things like that. You're paying for our time, and any assistance you would need from Jared. He gives a little break to USVA members. You're just paying for his time. So, we are all here to help the small businesses, and that's, we're not here to get rich. We're here to help people.
That's a big statement. That's very true too. I think the biggest thing I see, because I'm at least for everybody here too, I'm really blessed to be a new member of the group too. I'm really excited to be a part of the USVA now. I see this group as being really, really a tour de force, with Jared and Travis both leading to starting this court case for us to commune as a group and have a group of businesses that have a unified like mindset, and to have the help of Amber being able to walk each one of you guys forward. This is something really valuable. We wanted to move towards the next phase. And since this phase may not be the court case for determining the constitutionality of the product, we're shifting and using every resource that we have on the table to continue to serve the members. So me seeing that from the outside, I'm just humbled and happy to be here.
Yes, I just found you by, well, I don't consider it luck. I consider it was meant to be.
Yeah.
Because believe me, I've talked to probably 15 labs or more all over the country, in the US, in Canada, and nobody can beat anything that NN Analytics has to offer. I promise you that.
And also, Jake down here, Cindy asked a question. She always has good questions. So, and if you can see here what that is, I do. You explained that to me pretty good earlier, of the difference of people that just submitted. The people that just submitted a PMTA and we're waiting until it just, they came to the point of saying, hey, where's the rest of it? I think this is a good time to explain to Cindy here, what it means for the 9-9 with the steps that we're putting in place to have the testing put down,
sure,
and everything on paper. All right.
We touched on it a little briefly earlier, and Cindy, I want to save the meat of this to next week on the 13th. But to put it simply, there's not going to be a strict cutoff date on September 9th. But what we're working towards is eliminating that possibility in its entirety with testing. So if you don't get testing started by 9/9, let's be honest, the FDA isn't going to send enforcement agents out to every vape shop and say, pull all this product. No. It's not going to be physically possible. What they are going to start, though, is they're going to put some PMTAs into the, okay, let's sort some piles. We've got the we're working on it pile, and we've got the, we got everything we got from them pile. We don't want to go into that pile. We don't want to fall into the, well, looks like we got what we're going to get from them pile. We want to feed them either hard data or a plan that gives a specific timeline saying December 30th, this testing, February 7th, this result. And we want to stick to that date because we're going to extend that cutoff as long as humanly possible by not being able to allow them to say, well, we've got everything we've gotten from them. We've given them a timeline. We've told them wait for this data. So they are aware of that. And you would likely assume, and this is what they have done in the past with us so far, with other clients that we've done studies for, that we have continual data we're feeding them. The FDA wants to wait for the full study to finish before they can make a decision. And that's what we're taking full advantage of, you guys. Yeah, there's not a hard cutoff date.
And I think too, getting a contract with, via INS Analytics with in Analytics, stating that we're working on the testing process. That's another thing that you can send to the FDA and we can help you that, hey, I have a contract in place and I'm moving forward. And then, I can get the dates at a later time.
We even plan on preparing an empty study with all of the study design, photos of the products, test methods, limits of detection, and having that full document prepared and ready for you guys before the 9th, regardless if we've started testing or not, so they know we're serious. We're not preparing this just because we want to let you wait on us. This is actually happening. We're not screwing around.
And Roger, I read your comment. I will talk to you after this and be realistic with you about what you can do.
Thanks, Ember.
Yeah, see, and I don't know. I saw that question too, and I don't know if if y'all have already talked. Like, if people in the group watching this know like what the pricing deal that the USVA has gotten for this proposed testing plan, or are people still assuming it's like the prices that were talked about, before this kind of deal?
Oh.
And that will all be discussed on the 13th. Yeah. I've spoken with the people that I'm actually working on their PMTAs. They already know the pricing. We haven't put it out to everybody who I haven't dealt with on their PMTA, but I'm more than happy to speak with some of our members on a side note, because I've already spoken with Roger a lot in the past. In USVA communications and things along this line. So we just need to me and Roger need to have a serious conversation after this.
Absolutely. No, and thanks for that question or that comment too, Cindy. We want to be able to address this individually with each company. And next week on Tuesday, you guys will see the full cost of each one of the packages and its entirety as a whole. It's way more reasonable than you think. I don't want to talk about hard numbers, but I'll leave it in the range of we're talking individual thousands and no more per flavor. This is a really reasonable way to get the testing work done. And these are things that we don't plan on having the need to do all at one time. These are expenses to spread out over a time. And I think when Amber sits down, or when any of us sit down to talk with any of you guys, the goal is to put a plan and a timeline together that works, not needing to do all of it at one time and figuring out what's actually feasible.
So just look for Travis's link about the synthetic. Anybody that gets a deficiency letter, anything like that, you can message me. I can help you, and then I can send you to Jared because, I can help you get set up with Travis and kind of get you prepped to get you to Jared. But I will say this, if you haven't submitted a PMTA and you don't have synthetic on hand, you need to get it on hand now. because I've already dealt with somebody that was told on the phone to take their product off the market.
Okay, well, cool. So I guess at this point, have we covered everything? Anyone? A couple more seconds for any last questions down here that can pop up, but
yeah,
if not, then
excuse me.
Are you happy, Jared?
Yeah, I'm good. Yeah. Sorry.
On my end, I'm really excited to get to know all of you guys, all of you USVA members and businesses too.
I'm a direct person. Like, I don't take it the wrong way. I'm the nicest person you will ever meet, but I'm direct. I don't like to waste people's time. So like, some people think when I message them, I might be being short, and that's not it. I just don't want to, my time is precious, just like everybody else's. So that's, I'm just direct, honest, to the point, and, just try to help everybody the best I can.
Yep. Well, cool. We got a bunch of thank yous. Thank you all for watching in. This will stay up for a while. We'll just leave it here. That way people can go back and rewatch it, and stay tuned for the Thursday, July the 13th, and we'll be back here.
Thank you.
See y'all.
All right. Thanks, everybody.
Bye.
See you guys soon.